Adderall is such a controversial medication that's out there, so I want to go over it. The biggest controversy is that it's addictive, quote. When we say that in the field of medicine, what we mean really is a tolerance issue and a potential for abuse and potential difficulty coming off of it. That's what we mean. And when you talk about stimulants, this is the one that probably is the most likely to be abused. So that has to be kept in mind and leads to its controversy. But in terms of its efficacy, it's very powerful and very effective. So when you treat ADHD, it can be pretty much life-changing when you get it right. So I think of this medication sort of like the sharp knife in the kitchen, right? So if you're a chef, you're going to want the sharpest knife there is. But what happens? One wrong move and you lose a finger potentially. So you got to know what you're doing when you get to the point that you decide that Adderall is right for you. So what is it? It's a stimulant medication. It increases dopamine, norepinephrine, serotonin. It is an upper, for lack of a better word, sort of a caffeine effect, if you will. And when I think about this medication and similar things, especially as it relates to younger adolescents, children, I think of a study called MTA, which was the multimodal treatment study of children with ADHD. And I suggest you look it up, read it. I'll put a link in the comments, actually, that you can press on. So this study was very interesting. It broke up the people into 4 different categories: people who took medications for their ADHD, people who did therapy, people who combined the medications and therapy, and people who just did whatever was available in the community without the support of the study design. And what you could expect actually is what happened. So the folks that had a combined treatment and medication did better than all of the other categories, essentially. The study obviously had some flaws, which should be noted. So it didn't have a placebo group, which is normally a standard in clinical trials. Also, it tended to have mostly the male gender in the study, and the initial design didn't really account for longitudinal data, although follow-up studies have. Bottom line, I often think of this when I think of medications like Adderall, and it just reiterates the fact that when you do combine medications and therapy together, it's a game changer. As always, hit me up in the comments.